Okay, hi everybody. My name is Mary Maida. I'm with Canine Cancer Alliance and welcome to our webinar. Today we're going to talk about hemangiosarcoma. We have been talking to a lot of researchers, clinicians, different companies about hemangiosarcoma, as well as human version of this disease called angiosarcoma. And we just wanted to share some of the latest findings with you, including some of the findings from the research and clinical trials that we are supporting. So let me start the slides here. Okay. So it says part 1 here, and we'll probably have several hemangiosarcoma related webinars because there's just so much information to share, new information coming out, research studies, looking at early detection and also better treatments for dogs with cancer. Let's see. So the outline here is going to just do a quick introduction and cover some of the conventional treatments, including some of the treatments that's been available for quite a long time and not available also. Just share with you some of the data from those studies, share with you latest findings, especially from a conference that took place a couple of weeks ago, which was a World Veterinary Cancer Congress meeting. There are new findings that were shared there. I'm also going to talk a little bit about monitoring. Is it possible to monitor the progression of disease and find recurrence or metastasis before clinical signs are shown so that perhaps your clinician could take action? And big disclaimer, we are not veterinarians. I'm not a veterinarian. So this is not veterinary advice. And this is just information sharing. So you can take some of this information, digest it, and talk to your veterinarians about some of the options. So there we go. Let me start with just saying, what is Canine Cancer Alliance? Canine Cancer Alliance was founded in 2017 out of frustration with today's treatments for dogs with cancer. It's a charitable foundation, so we make an effort to raise funds so we can fund research and clinical trials for cures for dogs with cancer. The other point I wanted to share is that we are all volunteers. It's a volunteers-run organization. So if you are interested in helping us, please let us know. So I just wanted to say why I care so much about hemangiosarcoma. This is my dog's. I hate talking about this because I get emotional. But Hanako, all right, she had just turned 2, and her name means child, flower child. But anyway, we were focused on Gus, who's on the left side because he had osteosarcoma, and he had just had amputation, carboplatin, and then she started getting sick. And I said, well, there's no way a 2-year-old dog could get cancer. And unfortunately, on Christmas Day, we had to let her go. So it's just an awful disease. This is Simba, Jordan's dog, and it's not just golden retrievers and large dogs, and it could be small dogs and other breeds as well. But this is another beloved dog, and you guys are all probably know this very well. Why we have to address hemangiosarcoma. So with hemangiosarcoma, it could be visceral. Very often, hemangio is found on spleen, heart, liver for dogs. Could be cutaneous and subcutaneous. It's extremely aggressive. So if it's cutaneous, maybe there is a chance with surgical removal that the dog could be cured, but very often it does become metastasized. And people used to say that it's a cancer of endothelial cell lining the blood vessels, but now a more recent finding seems to indicate cancer that originates in bone marrow before these cells differentiate into endothelial cells. Typical options are surgery, if it's splenic, or cutaneous, subcutaneous. Chemotherapy is often said that it doesn't really make that much improvement, but it might, and I'll show you some data for that. It's extremely common for dogs and less common for other animals like cats, horses, and humans. And for humans, it is called angiosarcoma, and it has strong similarities with hemangiosarcoma. For humans, it's extremely rare, and breast cancer patients who get radiation therapy has an elevated risk of getting angiosarcoma. And also, there was an incident where there were several workers working in a factory, a chemical plastic plant, who ended up getting angiosarcoma. And what are the chances of multiple people in the same factory getting angiosarcoma? It's extremely low, but they were all exposed to vinyl chloride. Sometimes with environmental exposures that you could end up up with angiosarcoma. And we've been talking to a number of human oncologists that specialize in angiosarcoma to find out, where they're looking, what are promising clinical trials and things that they're doing to help people. So we talk about cures. The language is just always sounds so absolute, but medicine is all about probability and statistics. So and I know risk of getting cancer, or what is the risk of responding to a treatment. Now, unfortunately, with hemangiosarcoma, this is a curve, a Kaplan-Meier survival curve that shows a percentage of patients alive over time. With hemangiosarcoma, the curve goes down extremely rapidly. And this was a retrospective study that was done, and it almost always goes to zero. But the surprising finding is that there's always a few percentage of the dogs, maybe 10%, 5%, who ends up surviving, even though people say this is a deadly death sentence cancer. So there's something about hemangiosarcoma. There are always few survivors. And you have to also look at stratify these Kaplan-Meier survival curves based on the stage of the disease. So these are splenic hemangiosarcoma patients. Again, the number of patients surviving goes down extremely rapidly. But if you have stage 1, which means unruptured splenic hemangiosarcoma that's been surgically removed, then you actually have pretty good chance of surviving for a year or more. And if you start adding chemotherapy, it's going to get better. So when people show you data for hemangiosarcoma or other types of cancer, it's really important to always look to find out if it's been done with proper staging. It really matters. Now, one place that we looked at is this textbook. This had been re-edited in 2020, and this was I'm not sure exactly how well you can see how good the resolution is on your Zoom screen, but it shows a list of treatments given after splenectomy with dogs, and it mixes different stages. So it's a little bit like comparing apples and oranges, but here on the very top, it says dogs who got splenectomy, referencing 3 different studies. The mean survival times were between 19 and 86 days. Splenectomy plus A, which is doxorubicin, was 172 to 210 days. And if you go down the median survival times, it's like 144 days, 166 days. It's really, really not great. And then this number jumped out at us, 550 days here. Splenectomy plus doxorubicin with another chemotherapy. And now another one, which is splenectomy with chemo this is Muramyl tripeptide related based immunotherapy. And this had mean survival time of 277. And this one is eBAT, which is work done at University of Minnesota, plus doxorubicin, 258 standard mean survival times. So we wanted to find out a little bit more about what those data looked like and see if they're available. And we found out with that 550 days or 500 something days, that study was done in Italy, led by Laura Marcanato. And we spoke with her and we asked her about the dacarbazine chemo that was added to doxorubicin, because her survival time looked really good. Now, she also had some dogs with subcutaneous. It wasn't just splenic, but we asked her, why aren't more dogs being treated with dacarbazine? And the answer was, you have to balance out, of course, the side effects and the efficacy. And she felt that it was just not worth having the dogs go through a very, very harsh chemo treatment, especially dacarbazine, to get the extra survival time. Now, she has also done quite a few other studies in Italy that looks at adding metronomic chemotherapy after maximum tolerated dose chemotherapy. For example, this study in which she showed that if you just do chemo, maximum tolerated dose, versus if you now then switch over to metronomic chemotherapy, some of the dogs are surviving longer. I have to confess that I used to just sort of dismiss chemo as something that's just not desirable. It doesn't really work at all. But the more we look, there are some ways that you could use chemo that could help dogs. But again, you have to weigh the side effects and quality of life against the efficacy. Now, there is an immunotherapy in that table that was based on Muramyl tripeptide, which stimulates the immune system. It's a synthetic drug that creates a molecule that you can find in the lining. I did quite a few dogs with this. And these studies were actually carried out in 1990s. So it's really old study, but it was a randomized trial. And it showed that with this type of immune stimulation, you could get a longer survival times with dogs with hemangiosarcoma. hemangiosarcoma. So this drug is no longer available for veterinary use. It is available for pediatric use because it was approved in Europe for pediatric use, not in the US, but I have spoken to a parent of a pediatric osteosarcoma patient whose child did get this drug. So it is around, but it's just not, it's too expensive and it's not available for veterinary. Now, eBAT is something that you guys probably heard. It's a bispecific. It's a drug that targets EGFR receptor and delivers a toxin to the cancer cells. And this study was done at Minnesota, and they have some survival curves and data. This eBAT is right now not available, but University of Minnesota is carrying out an early detection and eBAT treatment clinical trial by invitation only with some dogs. However, this drug should become available hopefully toward the end of the year because there is a company that's trying to commercialize it. So that's good news. So what's new? So instead of chemotherapy or radiation therapy that tries to target and try to kill cancer cells directly, we believe that it's important to actually target other cells surrounding tumors because tumor cells can attract and modify cells around it to help them. So they turn them pro-tumorigenic and they turn the cells around it to be immune suppressive so that good immune cells like T cells can't get in to reach the cancer cells. So there should be a focus on cells that are helping tumor cells, not just the tumor cells. One kind of these cells are called fibroblast cells, and fibroblasts are cells that surround tumors. It creates structure, and CAF, cancer-associated fibroblast, researchers are finding out has all sorts of negative effects in helping cancer cells and suppressing the immune system. So we have just recently started a preclinical small pilot study with Colorado State University Professor Dan Regan to see if FAK inhibitor can actually interfere with cancer-associated fibroblasts to prevent migration and metastasis. And so this is an early stage study, but hopefully by the summertime we'll have some results to see if focusing on fibroblasts might make a difference. Now, another target is a sympathetic nervous system. There was a surprising finding. Very often science is based on these serendipitous findings. And there's a researcher named Elizabeth Rapatsky who was doing cancer research studies. She was working with two groups of mice. And with one group of mice, the cancer grew much faster than the other ones, even though everything was the same, except the room temperature. And they realized that the temperature of the room of the mice whose cancer grew really quickly was lower than the temperature of the room for the other mice. And these mice were under stress. And so that triggered lots of research in her group as well as other groups to see how sympathetic nervous system, how stress can help growth of cancer cells. And these sympathetic nerves, the ending of it will generate these molecules, epinephrine and these molecules that can actually help the tumor cells as well as all the other cells surrounding it, immune cells like regulatory T cells that suppress the immune system or macrophages. And so this researcher, Elizabeth Rapatsky, did was she introduced propranolol, a beta block, to suppress this mechanism. And lo and behold, the tumor growth stopped. And so propranolol, which is a beta blocker, which is a very widely available oral drug that's today used for hypertension, can have anti-cancer effects. And there's been a number of prospective and retrospective study. Here in this spot, this is a result of human cancer patients, ovarian cancer patients who just happened to be taking propranolol or a beta blocker, and they looked at the survival time. And then what they saw was those patients who were on propranolol, over 25% of those ovarian cancer patients were still alive compared to the others who were not on propranolol. Now, there has also been other studies with immunotherapy where they gave patients propranolol and immunotherapy. And those patients who were given propranolol on top of immunotherapy, larger percentage of them actually survived. And this was, again, with human melanoma patients. And there are actually quite a few other types of cancer propranolol now has been and is being tested with. Now, this graph is something picture I showed at the last webinar. This is a baby with something called hemangioma. Hemangioma is a benign version of hemangiosarcoma or angiosarcoma, and it's quite common in children and babies. And it usually doesn't interfere, it just goes away by itself, but sometimes it's quite severe. And this was another surprising discovery. It just so happened that this baby had to go on blood pressure medication. And lo and behold, once the propranolol was started, the angioma started to shrink, and then 4 months later, 7 months later, it completely cleared away. And so this group of French researchers decided to try it with other patients, gave them propranolol, and they published the results saying, hey, we figured out a way to cure hemangioma, the benign version, but it has the same vascular effect. And so they published the results in New England Journal of Medicine. And since then, there has been a number of studies looking at the use of propranolol with angiosarcoma. So this is a human version of hemangiosarcoma to see if propranolol can extend the median survival times for some of the patients. And they're seeing some results, good results with some patients, not always with others. 2 weeks ago, this was a surprising presentation, a poster presentation, the World Veterinary Cancer Congress meeting. This one. Okay. Here's a picture of a poster I took with the permission from the researcher. And this researcher is based in Peru, and it's a team in South America that looked at 29 cases of retrospective patients who were given surgery, and they had doxorubicin, and they're also given propranolol. And stage 2 cases were shown in red here, and they said that the mean survival time was over 400 days. This was visceral hemangiosarcoma patients, so it probably included some heart, liver, or spleen. And we don't know exactly what genders, what spaying, neuter conditions. We still have a lot to learn from this study. But this was actually a surprising finding about how effective propranolol was when it was added to doxorubicin. Now, I've spoken to veterinary oncologists, and one person I spoke to said, oh, he adds propranolol all the time because he thinks that he can much better results. He's seeing much longer survival time with his patients. Another oncologist I talked to, she said, no, I don't use propranolol. So it remains to be seen if it is effective or not. There is a prospective study run by Professor Erin Dickerson at University of Minnesota, and she's just wrapped up enrollment in analyzing data, and we're expecting her to publish what she found with propranolol plus doxorubicin. Now, also at that meeting, World Congress meeting, EGFR HER2 vaccine early study result was presented as a poster. This is work by Professor Mark Mamula and his team at Yale University, and Dr. Chelsea Tripp and other oncologists. And he presented early study data from 39 cases, and this is the Kaplan-Meier survival curve. So he compared dogs who got splenectomy. This is again splenic hemangiosarcoma only, splenectomy plus vaccine, and splenectomy plus chemotherapy and vaccine. And there's about 27 dogs. And the mean survival time, he said, was about 268 days for those dogs that got surgery, chemo, and vaccine. And unfortunately, it's not stratified by stages. So we don't know exactly what percentage was stage 1, stage 2, stage 3. We're looking forward to getting more details in the coming months. But this is hopeful news, both the news with propranolol and this vaccine. Now, in the last webinar, I described what checkpoint molecules are. Checkpoint molecules are there so that immune system does not go haywire. So you can suppress the immune system, so you don't end up with sepsis and autoimmune disease. But cancer takes advantage of these checkpoint molecules to actually turn off the immune system. So in this picture, you have a cancer cell, and it has something called PD-L1 molecule expressed on the surface. And when that molecule comes in contact with the T cells, PD-1 receptor, basically T cell gets turned off. And cancer actually uses this mechanism to suppress the immune system, and so it can continue to grow. But there's now a PD-1 checkpoint inhibitor for dogs called gilvetmab. And by the way, PD-1 checkpoint inhibitor is something that has revolutionized cancer treatment for human patients for the last 10 years. If you read the news and if you hear that immunotherapy is really changing the face of oncology, they're mostly talking about PD-1 and PD-L1 and CTLA-4 checkpoint inhibitors. They have made incurable cancer curable for subset of patients, not for all, subset of patients. Now, we've been waiting for checkpoint inhibitors to be introduced to canine patients, and Merck has recently introduced a drug called gilvetmab, and it works by interrupting the interaction between those two molecules, PD-L1 and PD-1, and it's been studied with dogs with mast cell tumors and melanoma, and it can be ordered. So we are starting a new study, or we are supporting a study led by Professor Muramyl that is going to be looking at EGFR HER2 vaccine and chemo and checkpoint inhibitor, because perhaps the reason the vaccine is not working is cancer is putting the brakes on the immune system. So we have to see if this is not going to cause awful side effects, and will it actually improve the efficacy of the vaccine. Now, I should mention that Gilvametov is available without being part of a clinical trial, but actually it's extremely expensive. Right now, actually, they might be out of stock, but it is very pricey. But the good news is there are other checkpoint molecules and checkpoint inhibitors that are being developed by other companies, other research groups, and hopefully in the next 2-3 years, they will come back. But Gilvametov is available, especially if you have pet insurance. It's something that you might want to ask your veterinarian about. It hasn't been tested with hemangiosarcoma yet. This clinical trial that we're starting is, I believe, the first one that is going to be using Gilvametov. I want to talk a little bit about early cancer detection and monitoring hemangiosarcoma progression. As you saw in many of these Kaplan-Meier survival curves, the earlier you find cancer, especially hemangiosarcoma, if it's stage 1, the chances of surviving is much better. Now, there are new cancer tests. Some of them are blood tests, some are urine tests, some saliva tests, and they're looking at cell-free DNA, or they're using worms to see if the worms go closer to cancer or not. Some of them use canine scent detection, some of them use Raman spectroscopy. I use different technologies, but these new tests are becoming commercialized. So if we can detect hemangiosarcoma earlier, that is a good thing, because today most hemangiosarcoma is discovered after there's bleeding and you go to emergency clinic and you have to do emergency surgery. So can we do reliable early cancer detection? And so we are working with different groups right now to sort of independently test how well these tests work for various cancers and for hemangiosarcoma and for hemangiosarcoma progression of disease. One test is looking at something called nucleosomes in blood. These are things that the DNA wraps around, and you have elevated level of, they chose H3 nucleosomes in blood. And the test is commercialized, comes from a company called Volition. It is quite affordable. I think it's under $100. And it does a decent job of detecting sort of systemic cancers like blood-based cancers and hemangiosarcoma. It does not do a good job with local cancers like osteosarcoma. And again, it's not perfect. So the sensitivity might be 70 or 80%. But you're very interested in finding out if a test like this can monitor the disease progression. So you might be able to, or a veterinarian might be able to take action before clinical signs appear. And we spoke with one of the inventors of NuQ Test, Dr. Heather Wilson-Robles, at the veterinary cancer meeting. And she was sharing some data where she was using this test to monitor a patient with hemangiosarcoma. And she was able to get blood sample from the dog before splenectomy, and she saw a very high elevated level of nucleosomes. And then after splenectomy, it shot down. And then as the dog came back for chemo treatments, it started to creep back up again. And so this monitoring technologies are something that I think is going to become better and better. Now, I also want to share with you another test. This is not yet commercialized test, but it's a test developed by a small company in Maryland. And they have a technology to screen blood and screen cells from blood samples from cancer patients. And what they're seeing are these very, very large cells, which they're calling cancer-associated macrophage-like cells, CAMLs. And compared to white blood cell, these CAMLs are giant, and they express molecules that are associated with cancer as well as macrophages. And so perhaps these are macrophage cells that had eaten the cancer or fused with the cancer. And they're finding really fascinating things with this test. They believe that they may be able to use this test to do early detection of cancer. They might be able to better prognosis. because they see many more and larger camels in patients who don't respond to treatment. And very recently, they actually were able to stain these camels to show PD-L1 expression. So as I said, PD-L1 expression is something you see on cancer cells, and it expresses PD-L1 to suppress the immune system. Now, researchers have known that when you test for PD-L1 expression in tumor sample before treatment and then give them checkpoint inhibitor, sometimes, well, checkpoint inhibitor works or not, it's not correlated with how much PD-L1 is expressed in the tumor cells. And that's because cancer responds to treatment and expresses PD-L1. So when they test before surgery, they may not be expressing PD-L1, but this is just a blood test. So you might be able to monitor the expression of PD-L1 as the treatment progresses. So they have recently published a result looking at, these are human patients who had PD-L1 level was low but became high after treatment. And those are the patients that responded really well to PD-1 or PD-L1 checkpoint inhibitor immunotherapy treatment. And those are showing blue compared to the red patients who had low level PD-L1 before and after the treatment. And so very often you hear about the importance of doing analysis of tumor samples or blood samples. We really need to be able to do dynamic analysis or sampling of tumors. And if it's not possible to go and do a biopsy, you might be able to do a blood test in the future to see what kind of changes are taking place. So I'm going to conclude by saying chemo might help. For a lot of people who are pessimistic about chemotherapy, but different types of chemo does exist. You have to weigh it with the side effects versus efficacy. I might try metronomic combination of chemo. I might add immunotherapy to it. Immunotherapy may help. Stimulating the immune system does help. Adding propranolol may help. Disease progressing needs more research. Right now, there is a test called Volition, NuQ Test from Volition, that can be used to maybe monitor hemangiosarcoma. It's not perfect, but it is commercially available. And there are other technologies being developed for monitoring currently. And we believe that combination treatments are promising. And also, you have to think carefully about the timing of the treatment. That's something else that's extremely important. So I'm going to conclude by saying that our nonprofit, we focus on funding research. And so we need funding. And if you would like to join our 5K, we have a new 7th annual walk and run 5K, and you could be a virtual participant. You don't have to show up in Redmond, Washington. You could join virtually, and the registration is open now. We would love to have you join us, and we'll send you a beautiful bandana and t-shirt, and we'll send you more invitations for webinars like this. And trying to have another webinar with Professor Muramyl, hopefully next month or the following month. And we would also love to hear from you on what kind of webinar, what kind of information you are looking for. So anyway, thank you so much, everybody, for joining us today. Okay.
Thank you so much.
Thank you. Bye.
Thank you very much.